Mothers are the backbone of our economy, and their children are the future of our economy. We know that when women do not get the health care they need, families suffer, communities suffer, and our nation suffers.
Motherhood in pregnancy and the first year of life can be an exciting but overwhelming period of time in women's lives. Some women face financial strain, a lack of social support, challenges accessing essential services, and mental health and substance use disorders. But as you just heard from Vice President Kamala Harris, supporting women and mothers is critical to helping our communities and our country. As our federal health agencies like the Department of Health and Human Services develops programs and resources for mothers and their young children, there's actually a really robust and innovative group of people behind the scenes optimizing digital access to public health resources and services for mothers. This group is found within U.S. Digital Service, or USDS. Founded 10 years ago within the Office of Management and Budget, USDS recruits and deploys teams of researchers, designers, evaluators, and engineers to federal agencies to help digital and public-facing services better deliver for the American people. The team brings in private sector talent for tours of 1 to 4 years to drive change, something that USDS co-founder Haley Van Dyke believes can transform how our government serves us.
We don't care about politics. We care about making government work better because it's the only one we've got. We are taking what Silicon Valley and the private sector has learned through a ton of hard work about how to build planetary scale digital services that delight users at lower cost, and we are applying that to government where it is a radical departure from the status quo.
USDS is an amazing team that works across all of our government, but today we're going to dive deep into its efforts to help mothers nationwide. This is Empathy Affect, the Fors Marsh Media podcast that explores the human side of government. I'm Melissa Harris-Szynski, and today we're joined by OMB's Birth of a Child portfolio lead, Maya Mechenbier. She's on her second tour with USDS and rejoined the team after becoming a mother herself. We'll get into how her journey in motherhood makes her think about her work and how she and other parents at USDS are helping families through their innovative programs. Maya, thank you for joining us on Empathy Affect. It's a really great honor to be able to speak to you and a little bit about the work that you do at USDS.
Sure.
And just to get things kicked off, I'd love to just break down what USDS is a little bit, since it's a team that supports many federal agencies, but is quite invisible for the average person trying to get what they need from a government agency. So can you briefly share a bit about how USDS works and how your work directly impacts and improves the way we interact with our government?
So since about 2014, USDS has impacted the lives of tens of millions of people. And these include small business owners, veterans, refugees, immigrants, farmers, students, all around the globe sometimes. And my work is centered on families in particular. What I love about USDS the most, and this is actually my second tour of duty here, is that each team is interdisciplinary. And that means we work collaboratively as engineers, product managers, human-centered designers, and researchers. And we work collaboratively with federal agencies as well, which I personally love because I used to be a career federal employee at the Department of Health and Human Services. And it's a really great experience, I think, as a career fed to have those private sector best practices come to help you and your team figure out how you can apply them in public service. And as you mentioned, we do short 1 to 4 year tours of duty. So it keeps things fresh. And we've always got some new folks here. Basically, we help agencies meet their mission through a combination of new perspectives on how technology can support their work. And we bring expertise in design, building products, and deploying the right technologies to meet agencies' needs and the needs of the American public. And with all of these different capabilities, we've supported agencies to enhance service delivery for the federal workforce and millions of Americans. Basically, every project is an opportunity to use technology and service delivery improvement to empower the American public and make our government more accessible, accountable, and efficient.
Yeah, and just going back to the touring aspect for a bit, USDS does keep your talent and expertise fresh and ready to serve through this model where you have your personnel to do tours that are, that 1 to 4 year period. And I know you had a career with the federal government before, but you did do your first tour in 2016. And as you just mentioned, you've come back now for your second tour. So what compelled you to join USDS in the first place with your first tour? And what drew you back?
Sure. I first heard about USDS while I was working in the Office of Science and Technology Policy at the White House in 2015. And there I was supporting President Obama's precision medicine initiative, working really closely with NIH. Joining the healthcare team at USDS was actually my first exposure to working on this kind of interdisciplinary team that I mentioned previously. I was the lawyer and policy advisor on the team, but I hadn't worked directly with designers or engineers before. And I really loved the experience of being able to learn from each other and collaborate and come up with more creative solutions than I think either side would have been able to come up with on their own. This is absolutely a set of experiences and skills that served me really well in that role. And also when I transitioned to private legal practice and was able to work with a variety of tech clients. And then when I came back, which was at the beginning of this administration, and I actually came back with two pretty concrete goals. First, I wanted to support the rollout of COVID vaccines around the country because it was 2021. And secondly, I wanted to help implement President Biden's vision for American families, which included childcare and paid leave, and maternal health as a major policy priority. Mm-hmm. So for my first year back at USDS, I supported the launch of vaccines.gov and other public health data projects alongside our CDC team. And towards the end of 2021, the customer experience executive order that the president signed in December gave many of us the opportunity to develop a set of projects that were focused on supporting mothers and their families from pregnancy through early childhood, which was really near and dear to my heart. And I feel really lucky to have been able to pursue that work for over 3 years now and see it go from idea to reality for many of the families that have been participating in our pilots.
Yeah, and I do think it's notable that between your tours with USDS that you became a mother. Congratulations.
Thank you.
Yeah, it's a great milestone, and I'm sure really informs your work now with what you do. So now as you've come back to USDS, you're leading a team developing solutions for agencies that help mothers and caregivers with young children. So can you share a little bit about your personal connection there? And what about motherhood made you think differently about the digital services you provide?
Yeah, absolutely. I have 2 daughters now. They're 7 and 4. And I would say they're definitely my inspiration every day to continue improving systems and services for women in this country. Before the last couple of years, I had actually built my career as a health, privacy, and regulatory lawyer. But I had always been really interested in maternal health. And I had had my own experience of having my first daughter, which really changed my understanding of what structural supports families really need in order to thrive, not just survive. And becoming a new mom is one of the most common experiences that women share. Over 80% of women over 40 have given birth at least once in their lifetime, actually. It's one of the biggest life transitions that I think you can make. And for many of us, it's the most significant interaction that we've had with the healthcare system, right? Who've been otherwise healthy. And it's an important inflection point in many of our lives in a time when we are often newly vulnerable in a way that we haven't been before, and we need support. You're exhausted, you're learning to take care of a new baby. You may also be taking a financial hit, given that unlike many of our peer nations, the US still does not have a national paid leave program. Mm-hmm. And at the same time, your household expenses have increased, including things like childcare, which is a major expense for many American families.
As Maya said, motherhood marks a great transition in women's lives, medically, socially, financially, and more. The immediate postnatal period of life is challenging for many mothers, especially for under-resourced women. So Maya and her team at USDS have been working alongside federal agencies like HHS to better support mothers through a few pilot projects in their 0 to 5 portfolio, which I'll let Maya explain.
These projects are all focused on creating better solutions to help mothers through pregnancy, childbirth, and raising children from the ages of 0 to 5. Mm-hmm. Through our research, our teams identified and piloted 3 customer-centered solutions that reduce burden and provide better support and resources to families. This includes alumni Peer Navigator Services that connect low-income families welcoming a new baby to supportive federally funded services like Medicaid, WIC, and TANF, and provide kind of social, psychological support as well, given that mental health and substance use disorder are actually a major contributor right now to maternal mortality in the US. So we wanted to make sure that the mental health aspect is actually folded in for all 3 projects. It's a big priority of ours. And then secondly, the Newborn Supply Kit Project provides low-income families with basic physical supplies and resources in the first few weeks after birth. It's actually 1 month's worth of diapers and other supplies. And our last project, Notify for Families, sends families text messages as reminders and guidance during benefits enrollment and renewal periods for programs like Medicaid, CHIP. And we actually have a new project that's going to be focused more on early intervention and early childhood coming up soon as well.
That's really great. I know that a lot of these are newer and things that you're iterating on, developing, but have you heard any stories about the impact that these projects have made on any of the folks that you're trying to help?
I'll talk a little bit about the Alumni Peer Navigator program. We're actually still collecting some of our end of pilot data for that project. But I can say anecdotally, we've already heard really positive feedback from the families that have gone through the program in terms of just feeling supported as they go through this journey. So one of the big pain points that we heard about in our research is that it can be really hard for new moms to even learn about benefits that they might be eligible for. And even once they've learned about them, to go through really complicated application processes. We spoke to one county where they said in their IT system that manages integrated applications for things like Medicaid, SNAP, WIC, all of these programs, that there were literally thousands of applications that were started but not completed, which I think speaks to the complexity of how, just how hard it is to get through some of these processes. So we wanted to address some of those pain points in the project. And what we really heard from families directly was that they wanted a human person to, like, somebody who had empathy, someone who had been through their own lived experience, someone from their community, someone who spoke their same language, to guide them through this process, someone who would pick up the phone and actually speak to them. They did not really necessarily want, they didn't want to necessarily go on a website or interact with an automated service. They wanted a real person who cared about them and would help them get through this process. So that's where the Peer Navigator model came from. And we're doing that in collaboration with HRSA, which is a division of HHS, Department of Health and Human Services, through their Healthy Start grant program, which is a longstanding grant program focused on reducing infant mortality. We have connected over 200 expectant mothers to a peer from their community who can guide them through understanding what benefits they might be eligible for, how to apply, and providing social and emotional support along the way.
And I know you've also had some success with the newborn supply kit. So how has the initial feedback been there too?
We have since 2023 delivered 3,000 kits through a public-private partnership between HHS and a nonprofit organization, Baby to Baby. And again, that contains 1 month's worth of basic supplies. We have heard, and I think have really promising initial results showing that this potentially reduces maternal stress, particularly financial stress, and improves trust in government, which I think we're excited about, because once you kind of establish a strong connection between communities and public health, for example, then you can think about things like vaccinations and breastfeeding guidance and other educational child development resources, like other things that we can get out to these communities, given that we've established trust through a program like this.
Just to get a bit more granular for a second, 63% of participants in the newborn supply kit program reported decreased financial stress, and 64% said it helped them feel less anxious and worried during the first few weeks home with their baby. This support means a lot to the mothers and families of those 3,000 children. And beyond the immediate postnatal period, USDS has also helped agencies' digital efforts in supporting families with childcare, navigating the infant formula shortage, and more.
We also worked with the Administration for Children and Families, which is another component of HHS, on reducing the burden of childcare assistance applications a couple years ago. The problem that we heard from the community was that there's a significant paperwork burden and application hurdle as families navigate a sometimes confusing and complicated application process to secure childcare subsidies in particular. So we worked with ACF to create a guide for states, territories, and tribes called the Guide to Creating a Family-Friendly Childcare Assistance Application, with the goal of reducing burdens and breaking down barriers for families that need childcare assistance within weeks instead of months. And there was a lot of research with childcare providers, with states, with counties that went into the development of that. So that's a resource that's available now for folks that want to think about improving some of their systems to make it easier for families to access that benefit. And then the second one is helping the country navigate the infant formula shortage. In the summer of 2022, there was a baby formula out of stock rate of 70% by the end of May, as you might remember. USDS really jumped into action and partnered with HHS and other components of the White House to develop a potential solution in terms of data analysis that led to Operation Fly formula flights that fed thousands of babies that had specialty medical needs and were the most impacted by the shortage.
As we've been talking, I sort of just think about all of the different talent you've mentioned going into a successful outcome, like the researchers, evaluators, designers. But USDS's web of personal experiences, such as you and your journey with motherhood, have also informed your work. So, how does USDS's diversity of talent and backgrounds inform and strengthen the UX design across your projects?
Sure. So we have always centered equity at the core of our project design and implementation. And a key principle of that work has been to design for the most complex use case, as this can ultimately make the service more simple and seamless and accessible for everybody. And I think a diversity of our staff is really critical to bringing every idea and being the most creative that we can in service of that goal. So consistent with USDS's core values for the 0 to 5 projects or the birth of a child project, we co-created each concept with families and staff that serve those families, because we knew that any solution we designed would have to add value and work feasibly for both parents and community health workers and case managers and doulas and folks that are working with these families all the time. Because it's a service delivery chain, right? And there's multiple people that are involved at different points in the chain. So any solution or set of solutions has to be something that works for everyone. Our team has expanded over the last couple of years in a way that I'm quite proud of and makes me really happy. We've become more diverse, and each team member really does bring her own unique set of experiences and background to add important perspective and bring a unique value add to the work, right? We also have a distributed team, which is kind of interesting. So we have folks living in Texas, Georgia, Arkansas, and New York, and then we have folks in DC as well. But I think bringing that diverse and geographically diverse remote perspective helps a lot. We've actually got folks who happen to live near some of our pilot sites and run into some of the folks that we work with in their community. And I actually think that really helps, right? And it helps build trust between us and our pilot sites to know that like not everybody from the team comes from the same kind of place, and that there are people, public servants who work all over the country. And many of the women on our team, I also have to mention, are moms ourselves. And we've supported each other through, things like our own childcare woes or kids' illnesses. And I really think that contributes to bringing a certain amount of empathy and perspective to the work that we do every day.
Absolutely. And it's really awesome that you have such a dispersed team that can be a part of their own communities and see how the work you're doing impacts them. Along those lines, too, can you share more about how you get feedback on your projects and how you incorporate it into improving your work?
Yeah, so we've spent a significant amount of time on the ground with our partners, and our partners are largely community-based organizations that have really strong ties to the populations that we aim to support. And the goal of all of this is to meet the families that we're serving face to face and get their feedback directly on how things are working and incorporate their feedback into our program design and implementation. It's important that we go where the work is. And so that's, whether that's our sites in Baton Rouge or North Dakota or Atlanta, we have connected with families that have limited English proficiency, single parent households, immigrant families, families of color, including Black and Indigenous families, and families that have a caregiver experiencing substance use disorder, all kinds of folks. And in addition to these in-person design sessions where we get to interact with people, we've been intentional about conducting program evaluation really rapidly and iteratively. So not a waterfall approach, but kind of incorporating that into our program design more regularly. And I think that's really helped in terms of program implementation and getting buy-in for scaling and sustaining these programs as well. So the strategy includes surveys that we conduct pre and post intervention. And we, as I mentioned, have posted publicly some of our initial results for newborn supply kit already. We plan to follow up across all 3 projects with more comprehensive evaluation results later this spring and into the summer. And I should mention for Notify for Families, we actually plan to do a randomized control trial evaluation, which will be a new one for one of these projects that I'm kind of excited about.
Yeah, definitely. It sounds like you have a lot of different ways to sort of engage and meaningfully build on, how things are going. I know we've talked a lot about different wins and growth that you've seen throughout the projects you do at USDS, but I also want to ask, What has been some of the most surprising or exciting parts about working with USDS?
Yeah, so I will say I had not done a set of projects that had such a rigorous evaluation process before. And I think I've learned a lot about evaluation and different types of evaluation and what is the most efficacious for particular interventions. That not every intervention will work with the same consistent evaluation approach. And so we're really excited about a couple things: expansion options for newborn supply kit, a different evaluation approach for our Peer Navigator program that is kind of more community-based and participatory in nature, meaning that like our pilot sites contribute more to the actual evaluation goals and outcomes and the strategy, as opposed to it being kind of like a top-down approach or an independent evaluation that's kind of coming in from a third party. I think there's just a lot of different ways that you can do it. And for this particular intervention, we're excited about learning about and pursuing a different community-based approach in 2024 and beyond. We are also always interested in exploring new avenues for public-private partnerships with the private sector to scale all of these interventions around the country. So if any of your listeners want to get in touch or they're interested in learning more about that, they should reach out. I think the other thing that's interesting about our set of projects, which was also somewhat new to me as a longtime Fed, is the level of transparency about progress towards our milestones that has been very important to the federal customer experience team. So for all of the portfolios, the life experience work, you can see our public milestones and our progress on performance.gov. And for our work in particular, performance.gov/baby. And we actually will be posting, I think, a set of updates in a few weeks as well. But that, I think, keeps everybody on task and accountable in a way that is exciting for me because it keeps momentum going and it ensures that we report out on our progress to the American people, which has been actually a very useful thing for moving the work forward.
Absolutely. Before I hit on my last question too, I'm also just curious, you're in your second tour now. Do you see yourself maybe doing a third or, continuing your work in the digital space, whether it's in federal health or public health down the road?
Such a good question, Melissa, and it's actually something I think about all the time right now. So my personal, I started, as I mentioned, I came back in January of 2021. And so I am on a 4-year term right now, which will end in January of this coming year. And I think I would be interested in exploring other opportunities potentially in the maternal health and early childhood space. But I don't know that I'm going to go back to my career as kind of like a healthcare regulatory lawyer because I have become so passionate about this domain. And there's still just so much work to be done. So I think no matter whether it's public or private sector, I would really love to kind of stay working in maternal health and early childhood.
I love it. Do you ever think about the work you do and think about the future that you want to set forth for your daughters?
All the time. Yeah. It's so funny. My kids ask questions about work all the time. And it's also funny because many of us work remotely. We work from home now, right? By and large. And so I think this is true public or private sector. And so many of our kids just see us in front of the computer at home, which is different from going to the office, right? And so for a small kid, they look at that and they're like, I wonder what mom is actually doing all day, right? So my daughter last year when she was 6, she asked at one point, what button do I have to press on the computer to make money? Like she doesn't get it. She's like, what is mom doing there? Like, what's that? What is she typing away about? So I think to go back to your question, I think that I want to show my daughters that my work is meaningful to me. That's important, right? To show that mom is at work and sometimes spending time away from you, or, if I ever have to pick her up late from aftercare, that mom is spending time doing something that really matters to me. And that I believe, that the work has an impact for other American families. And so we do talk about that, right? We talk about things like homelessness and what the government is doing to help people who are going through homelessness, and that not everybody has the same set of resources and tools when they start out in life, and what might we be able to do to make that more equitable, and what does it take to change systems. So all of that, I think, it's so interesting to look at some of those questions from a child's eyes and explain some of those things to a small kid, because it really actually makes you think about some of those basic things in order to explain them in plain English, right? And in simple terms. So yeah, I think about them all the time in terms of what we do. And as I mentioned before, we're really I think lucky there are so many parents on the team that I think we often, or all of us, thinking about our kids and thinking about our own experiences as we continue on with this work.
Absolutely. And it's wonderful that you do. Now, as we wrap up here, our government's digital needs have kept moving and technology keeps evolving. You came back to USDS to help navigate, this country through COVID-19. And now you're doing wonderful work addressing maternal health and well-being. And on top of that, all of USDS is just helping so many different elements of our federal agencies' work. So I know you're in your final stretch here for this current tour you're doing with USDS. What's really exciting to you this year as you wrap up this tour with USDS?
Yeah, so we're really excited about, I think, the direction that each of our pilots is going in 2024. We are actively, as I mentioned, considering expansion options for newborn supply kit. We're exploring the possibility of providing kits to our veteran population within the Veterans Health Administration, which I personally am very excited about going forward. And then for our Peer Navigator program, we're interested in better understanding how the peers can best support moms with issues like mental health, domestic violence, and substance use disorder, given that all of these issues are major contributors to maternal mortality and morbidity, to see if we can, draw a connection between the peer support and some of these major public health priorities that we have. And then we're also, as I mentioned, anticipating evaluation results for our Notify program later this year, where we hope to learn more about the efficacy of text messaging and helping families maintain coverage in Medicaid and also connect to other supportive services. So I think there's a lot of really exciting movement. And I think what's the most exciting too is how much buy-in and support we've gotten from our colleagues at HHS. I feel very confident that no matter who is in OMB or at USDS working on these projects, that our HHS colleagues are so supportive and really feel their own sense of passion and accountability and connection to this work, that it's going to survive, I hope, for many years to come.
Awesome. Thank you so much, Maya, again, for joining us on the show. I know that USDS may seem like quite the invisible team, but you're very present in making such an impact in different people's lives. So just a quick shout out and thank you to you and all of your colleagues for the work you do.
Thank you, Melissa. It was a pleasure talking to you.
Thanks again to Maya and her team at USDS. If you want to learn more about the programs we talked about today or the other work that USDS has done across our government, check out our links in the show notes. Next month on Empathy Affect, we're going to get into tobacco use prevention. We'll be joined by two guests from the U.S. Food and Drug Administration's Center for Tobacco Products to learn about how they're preventing teenagers and young people from smoking, especially amid the rise of vaping.
As soon as I started vaping, I started having panic attacks. I thought it just affected your body and not your mindset.
It was making me feel less than who I was. My confidence was just dropping.
It's a heavy but important conversation, especially as tobacco products are changing as fast as our media landscape, making the science of messaging and education a tricky one. Join us next month to tune into the full conversation. In the meantime, follow, subscribe, and share the show with a friend. And don't forget to rate us on the podcast platform of your choice. Thanks, y'all.
Empathy Effect is a product of Fors Marsh. You can reach us at Fors Marsh Media at forsmarsh.com with any feedback, questions, or inquiries. If you want to know more about today's guest, are interested in participating with Fors Marsh, or becoming part of our community, check out our show notes for more information.